People may ask, why do we take such a comprehensive, patient-centered approach? Because every patient deserves more than just a patch. They deserve a chance to recover.
Today we have the opportunity to learn about a very rare and very severe pain condition. It was first described in the 16th century and since then has gone by many names. Causalgia, reflex sympathetic dystrophy, or RSD, and most recently the International Association for the Study of Pain coined the term complex regional pain syndrome. It's a very difficult to diagnose condition. In fact, it's not made by any objective test, whether that's a lab result, imaging result, or nerve study. It's done by a clinical set of criteria known as the Budapest criteria. There are 4 categories. One is maybe one side of your body will become extra sensitive, or even you just touch it lightly and it's very painful. Some people express even wind blowing across their skin can be uncomfortable. The second category is changes in sweating or swelling as compared to the other side. Third category might be changes in temperature or color of the skin. And as the disease progresses, we reach category 4, where you have motor changes, muscle weakness, atrophy of the skin, hair, and nails. And eventually you start to lose range of motion and function of that limb. We don't really know what causes it. We know it's associated with the immune system. We know it's associated with the nervous system. There's many theories and probably multiple reasons why this condition happens. Fortunately for most, it is a very rare condition, but it does affect between 2 and 3 people out of 10,000 people every year. Probably affects more women than males for whatever reason. And today we're very fortunate to be joined by a patient, Miss Nelda, who has this condition. And she has volunteered herself today to share with us her story so we can learn more about this and perhaps help someone else out there who might be dealing with similar symptoms. Nelda, thank you for being here.
You're welcome. Thank you.
Thank you. So, you were first diagnosed with complex regional pain syndrome back in the 90s?
Yes, in the 90s. My injury date was 1/13/93, and by April 94, I was diagnosed because the injury was so subtle. And then we're going through the steps of a physical therapy, pain management, and so forth before I was diagnosed.
So most people, when they're diagnosed with complex regional pain syndrome, it usually follows a fracture or a surgery or some
Yes.
other traumatic injury. What happened in your case?
What happened in my case is I worked as a legal assistant in a law office in downtown Dallas. Some ladies and I were all walking in together. We tripped. I fell over and I just kind of hit my neck. It didn't hurt. It was just a stun. I got up and went with on my day, no problem. But the next morning I woke up with my ear attached to my shoulder. I couldn't move or anything. Was painful. Even turning around was painful. I went to just my doctor, and he gave me a muscle relaxer that knocked me out, and also it did let go of the muscle, but the pain was still there. So he sent me to physical therapy. My physical therapist, God bless her, and like I said, she was just so wonderful because she is the one that saw that something else was going on. When she would do the exercises with me, I would have more pain instead of relief. Also, the blood would come out of my arm, so it would get even to 20 degrees colder than the right. And unbelievable sweating.
So you were doing physical therapy
Yes.
and you went maybe for several visits, but you weren't seeing the
Yes.
progress that you wanted to.
Right. And she was noticing that it wasn't helping. She's the one. I was just assuming that was you're supposed to feel that way. I really thought that when I left physical therapy that I was supposed to hurt for the whole day, or you know what I mean? I had no idea. And she's the one who said, "Oh no, you're supposed to be feeling better." And I was feeling worse. She noticed the temperature changing. She said, "No, there's something else going on." So she referred me to the Texas Back Institute. The doctors there were real interested. The doctor I happened to see, he'd seen something like this before and he was shocked. He did a really terrible test that I was supposed to show the electrical impulses, I guess, in your arm. And I was having extreme um, reactions to those little mild currents and extreme pain and shooting up. And he's the one who diagnosed me with reflex sympathetic dystrophy.
Wow. So it sounds like maybe you underwent a nerve study at that point.
Yes.
And for those of you watching, it's also known as an electromyography test or a nerve conduction study. And that's where they put electrodes on your arm and they shock the nerves with electricity. And they're looking to see how well those nerves are functioning. And then there's also a needle component, right?
Yes.
Where they put that in your muscles.
That was evil.
Yeah. I would say for most people, it's pretty well tolerated procedure. It
Yes.
sounds bad, but it's not that bad. But for you,
Right. That's what he said. You know,
you
it
couldn't
was
tolerate it.
right.
Mhm.
The mild shows is extreme. He said, what happened is like turning on a light. Say, during an injury, your fight or flight reacts, and so it thinks you're bleeding to death from your arm, so it brings the blood to your organs so you don't die. Well, my brain all of a sudden went clink to the pain of that and just decided to stay there. It just never shut off. So he said it's like turning the light on for pain and then it just didn't turn off.
I presume you got into some sort of pain management program shortly after that.
Yes, he started with hydrocodone first and gabapentin, Lyrica, Tegretol. There were a lot of medicines that he gave me. I will say gabapentin helps. It does help. But my pain medicines weren't working. I was screaming all the time. I couldn't be touched. I couldn't do. Wearing clothes is a thing. um, because just wearing clothes hurts. You know, my touching myself hurts, but I know how much to touch. He started with the hydrocodone. That wasn't enough. He started giving me morphine, oral morphine. Forgot he injected it in the butt. And that wasn't enough. Uh, then he started me on the Dilaudid. And when they saw the Dilaudid was helping, that's when I started getting fitted for a morphine pump.
Okay.
And they installed the morphine pump. It did help, but you know you have that control, so a lot of times you can hit a little bit, but it was never enough. So I was taking 10 milligrams of OxyContin, 8 of them a day, and then 8 Xanax a day, on top of all the other medications. And at that time, the pain was just so extreme, and I had no idea that the opioids were just making it worse, not better. You know, they were fitted in order to make that body desire that and feel everything to the extreme.
Sounds like you were getting pretty high up on the pills, and so
Oh,
they decided to put a pump in,
mm-hmm.
but you still had pills on top of that.
Oh yeah. And it still
It
wasn't
wasn't helping.
enough. No, it still wasn't enough for everything. I mean, um, I still had really bad days. It was still where I was able to maintain a household. That's what it took in order for me to keep going. I have daughters, you know, kids.
I think they ended up doing surgery even at some point for you.
Yes, I've had sympathectomy. I've had back surgeries. I've had countless stellate ganglion blocks. There was one that paralyzed. He went too far and it paralyzed my arm. And that was the best day because I didn't care that it was. I said, I'll just strap it to myself with duct tape and keep on going. I didn't care that he was shocked and he said, no, 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 no. And that stopped. The block stopped because that for a few years. And then they started the blocks again.
So you had the blocks before the surgery.
Before the sympathectomy?
Right.
No, I had the sympathectomy. Well, yes, I did. Blocks first, sympathectomy, blocks again.
So a sympathetic block is essentially where you put an injection of lidocaine and probably some steroid over a bundle of nerves that lives in the front of your neck, and those bundle of nerves control the blood pressure and some of the nervous sensations coming out of your arm.
Mm-hmm.
Did those ever work?
We would do 3 in a row, like Tuesday, Wednesday, Thursday. And I would get relief for about 2 months. Tolerable, a 5, and I was good. And then little by little, it would just start coming back again and reschedule, and we'd do 3 in a row.
And that's what prompted the idea to just take all those nerves out.
Yes.
With the sympathectomy.
Yes,
Yeah.
they did the sympathectomy, and none of that happened. It didn't. It was a bad decision because now they see that the sympathectomies do not work for RSD. It was too extreme, but they didn't know it back then, and I was very willing to try anything. I didn't care. I was constantly thinking about myself, so it was that bad, or I was so doped up I wasn't participating in my life.
Mm-hmm. So where did you end up then? I mean, I think there was quite a bit of time before you came to this clinic.
Yes.
And you had the surgery.
Yes.
How were you getting by?
I was still under pump. I still had my morphine pump. I was still getting my OxyContin until 2020, until the pandemic. But before the pandemic, I was getting pain relief, more pain relief, just getting better and better and better. And I'm being able to get out and do things. I was doing more. It was getting better. And then 2020 happened. Everybody got stuck inside. I had my pump removed because it was supposed to get renewed, every 7 years. I went in, I ended up with an infection. So he had to pull it out. And I was feeling better without it than with. And so I said, no, we're not going to go and put it again. It took a while, but it was enough. The morphine, oral morphine, and no pump, and just my other medicines. The Xanax still though, because the anxiety still goes crazy. I didn't take them, I would hoard them. On my good days, I didn't need them. But on my bad days, I really needed them. On 8 a day, I could take 20 of the Xanax, 20 of the OxyContin, and nothing. People were afraid because I could myself so easily because it didn't help. Nothing was helping. Mm-hmm. Completely. Everything, I could build up a tolerance to these meds, and they wouldn't work anymore. But really, when I got off the pump, it got better. I was doing better, feeling better. And then I was doing more. I bought myself a truck. I was driving again. I was getting a shower every other day and even close to enjoying them. Wearing makeup, doing my hair, getting out of the house. It was just so great. And then September 16th, 2020, we had a really, really bad freaking storm. Electric storm that just sat on us, and my RSD just shot up with I don't know if this is one thing that too, is people with RSD can feel lightning. We can feel the electricity in the air. It's that sensitive. You feel it. You can feel electricity, and so you can feel a lightning go through, and before you even hear it, and you know it's not all the time, maybe twice a year that would happen. And on that day, it wouldn't stop. I was screaming and screaming, and it wouldn't stop. And there we go. It was all back again.
Wow.
And
So a couple points there. You mentioned you felt better after getting rid of the pump.
mhm,
I think, our understanding of opioids is probably more complex than just saying pain, opioid, better,
right,
right?
right.
Especially, I think the longer you take it, it really sort of changes how your brain processes pain. And you can even have heightened sensitivities to pain with the longer that you take opioid medicine,
Exactly. That's what I
right?
found out after. So it was the opioids were really making my RSD worse, not better.
So you were better for a period,
Yes.
and then the storm was like, oh, wait, just so you know, this is still here.
Yes. And then
Mm,
it went down to the whole left side, not just my upper, where it was all on and off. It became on all
hmm
the time. And so it was the whole left side this time.
How were you functioning throughout this process? I can't imagine
You don't.
30 years living with something like this.
It's, um, I'm a positive person. I always make the best out of situations. And so I just kept saying, tomorrow will be better.
One day at a time.
Yeah, tomorrow will be better. Tomorrow I won't hurt so much. Or, in a couple hours, I'll feel better. You're constantly talking to yourself because the other voice is going, I can't live like this anymore. I can't stand this. Oh my God, oh my God. I can't. You want to run away, and you can't run out of your own body.
hmm
I have thoughts like that all the time.
hmm So you went through all these processes. You had all the medicine, opioids, gabapentin, Lyrica, seizure medicines. You had the surgery. You had the injections,
Hmm.
the pain pump.
Yes.
At any point during this process, did someone maybe offer you a spinal cord stimulator or some other type of medicine?
Yes, I had a temporary spinal cord stimulator, but that didn't even last a day. I couldn't have it. The but it just hit me wrong. It
hmm
wasn't for me and made
hmm
it worse instead of better.
hmm
That's when they went to the pump because they did the 10th unit first.
Where they
So,
put the wires in your spine? Yeah.
yes, they did that first. And like I said, turning it on, not even 24 hours. It had to be turned off until and rescheduled to take it out. Yes, it was it's not like a limb, I guess. I don't know. It was the whole left side.
Well, and that's the unique thing with you, I think. Most people will only have one arm or one leg that's affected,
Yes,
but for you, it was the whole left side.
yes.
And probably due to your fall, and I think they gave you a diagnosis of even spinal cord injury.
Yeah, catastrophic, non-paralyzing spinal cord injury.
Right.
Yes.
Now, to be fair, a spinal cord stimulator doesn't have the range to treat an arm and a leg. Really, it's an arm or a leg,
Right.
right?
Mhm.
Unless you put in multiple leads. But for a trial, I can see why maybe that wasn't the best option for you.
Right. They saw that immediately. Like I said, they did and turned it off within 24 hours.
I just want to highlight that because a stimulator is actually a really good treatment for most people with
Yeah.
RSD or
Yes.
complex regional pain syndrome, just not in your case.
My Uncle Miley, he was a year older than me. He also has RSD. He was diagnosed from a surgery on his right side, and he has a stimulator, and it's worked for him.
hmm
They're taking it out now, but he might try a new one. 'Cause they said the technology, you have said the technology, it's just gone really great for that kind of a stimulator.
Right.
So that's still up in the air whether they're going to replace it or stop completely.
So by the time you came here, you almost gave me an impossible question to answer because you've already been through.
It was desperation going back to a pain doctor because I told myself I was never going to do it again. But I got really bad.
Can I ask why? What was your fear of going back to a pain doctor?
Pain meds.
Yeah.
Pain meds. Those opioids are no joke, man.
Yeah.
You know what they used to, and they've said it in front of my mom. They started with the hydrocodone, also with the V. I don't remember the name of it. Not with a V, something. Morphine, oral morphine. All of these medications. I was so afraid. I said, but I don't want to take anything that's going to get it addicted. And this is the response I got from so many doctors. You're going to get addicted. We'll deal with that later. You can't. It's.
I think the fear of addiction is real. It should exist, right? We
Yes.
have to practice safely.
Oh, yes.
I'm afraid sometimes the fear of addiction may outweigh the fear of even more potentially negative side effects.
Yes.
For people with unmanaged pain.
Yes.
Yeah.
Definitely.
Yeah.
There are medications that would work with us. And Miley, he's on a couple of new meds, pain meds. I even like I told myself I wasn't going to do it again, and that's why when I came to you, the very first thing was I don't want pain medication.
Right.
And you asked me, what can I do to help you? It was unbelievable when you did that.
So I didn't put you on opioids.
No. You asked me, what have I had that helped in the past? And I told you the blocks. And you scheduled the block for me.
So we did the block.
We did the block, and it didn't
Not
help.
super helpful. Yeah.
No.
But then again, you had a lot of those nerves surgically removed, so.
Yes. See, that's the whole point.
That's another unique issue here. What did we ended up putting you on a medicine I don't think you've tried before.
Right. It was the ketamine.
Ketamine. Yeah.
I've been waiting for ketamine since 1999 when I read the study on clinical trials in Germany for RSD and how they were putting patients into a medically induced coma with ketamine for 3 days. And they were getting results of like Control-Alt-Enter rebooting of the brain. And it was just helping those people immediately, immediately.
Right.
But as you said before, the earlier the diagnosis, the earlier the treatment, the best results you're going to get.
Right.
And I've had this now since 1993. So mine's going to be harder, but that's okay.
So admittedly, there's not a whole lot of studies that look at the use of ketamine.
Right. There weren't.
Especially for complex regional pain syndrome.
I was watching, and when I read about the trial, but it didn't come out till 2001, the results, and they were just so enthusiastic about it because they were getting really great results from that ketamine infusions or ketamine comas, medically induced comas. And I talked to you about it when I came here, about because I knew it had been approved here in the United States now. And so like, okay, this is what's going to help me.
Right.
Because I've been waiting and it's going to help me. And you started on the oral ketamine for me because we couldn't do the infusions. And I didn't feel anything until a couple of months later when I realized I was handling the pain better. I wasn't wanting to scream out of my skin. Yes, the pain was high, but I was calmer. And my mother noticed it right off the bat. And I started noticing it, and then I told you how it was getting better, but we kind of hit a thing, and you just up the dosage a little bit, and it's been helping so much, so
Yeah.
much.
I don't want to be overly dramatic, but when you first came in, you were in a way. I mean, the pain really had a hold of you.
Oh yeah, I was. I've never been depressed like that. For the 2 years before I came to you, since I went through the whole left side, I stopped everything. I completely fell out of my life and put myself in a hole. And I was planning my departure.
Hmm.
I put myself into mental health because I've been afraid that I'm going to myself,
Hmm.
because that's all you think about. You just can't stand it anymore. You can't sleep. You can't lay down. You can't sit down. You're standing, and that's and you're wanting to run and run and run and run.
And your focus wasn't necessarily to leave this life. Your
No,
focus was to stop the pain
yes,
by
sir.
any means
Oh
necessary.
man.
Yeah.
And since my kids were all grown, my grandkids grown,
Hmm.
I was planning it. Honestly,
Well,
I
praise
really
God that
was.
we found a solution. Wow.
Yes, yes. Because again, I'm calmer. I can get it better into control. Looked into the ketamine infusions, and since they weren't approved for pain treatment, but they're approved for clinical depression. So I called around and I found out that, yeah, I can go in there and have one done on my own if I pay for it myself. And it was $1,500. And that's whenever you said, why don't we start you on the oral? And let's see. And
Hmm.
I knew it was going to help because 85% get relief. I'm not saying it's going to cure you. I'm saying it's going to help, period.
What kind of things could you do after we started you on a good regimen that you couldn't do before?
Oh, taking a shower hardly, uh, cooking dinner without having to get off. It's up and down, standing in one place. Uh, wear clothes. Be in a car. Before Dr. Leak, before I came here, I had been 4 months in my house without leaving it. Not to the grocery store, not to walk down the street because I couldn't walk. I couldn't do anything, and I just wanted to drop out and constant. I couldn't do
Yeah.
anything, And so you're calling around and finally finding someone doc, to be to see me, and the way you asked me, what can I do to help you? What was, um, what has helped before? Things like that, because you don't want to say, give me drugs, because you don't really want the drugs.
Yeah.
It doesn't help. This kind of pain, some drugs, I'm sure, give you some relief, but being all doped up is the only way you kind of get by on this, because you're just all doped up. And my whole family, they're so supportive because my uncle also has it. They have a greater understanding of this, and for some reason it can also be in the DNA, the injury you have, or that you can have it, this sort of thing. And that's why my uncle Miley has it, because we are injured the same way, I guess, and it can be in your DNA.
That is true. There is some speculation, certainly, that there's some DNA components, some genetic components to this process as well. Absolutely.
I've read that too.
I mean, considering the fact that it is so rare and you have members in your family that have it as well, that seems statistically unlikely.
Yes, that's
Right.
what that's why,
Yeah.
yes, yeah. And we were seeing the same doctor because, and the crazy thing is, as I know what he's feeling When I'm hurting, I know he's hurting. When he's hurting, he knows I'm hurting. And um, even the strengths, even uh, the craziness, we can talk to each other and say those things out loud, and and not be worrying the
Yeah.
family, my mother, my sister, my brothers, my kids.
Well, I'm so grateful that you were kind enough to share your story. When I first heard it, I was just taken back because I saw you dealing with something that was pretty much as long as my entire lifespan. And you've been through every possible treatment up to this point, and you came from such a dark place, and all we had to do was start you on one little pill.
Yes.
Now, I'm not saying ketamine is like the perfect medication for
No, I know,
everybody,
no, I
right?
understand that.
It's still a dangerous medication,
Yes, it is.
still needs close monitoring, um, and it's not for every condition. But to see you come through where you are in this dark, dark, dark place, where you're on your wits' end, and to make such a turnaround, I was inspired.
I couldn't believe it.
I was inspired by your resilience. What do you have to say to somebody else that may be listening that is suffering maybe the way you were?
Tomorrow will be better. You just have to keep on. It's just like anything else, you know. Tomorrow's going to be a better day. You had a bad day at work or you had a bad pain day. Kind of the same thing. You have to have hope that tomorrow will be better. All these years, I had hope until September 16, 2022. Whenever I had been doing so much better for years, 5 years, you know, and I was volunteering, I was teaching classes, uh, I was part of humanity again, people being out there. And then when that storm came, it changed my life again.
Yeah.
So I went to that really dark place that I'd never really let myself go. I would always talk to myself. My Uncle Molly's very positive too. And I put myself in the hospital a couple of times because I couldn't get those thoughts out of my head. And I know myself. I don't think
Yeah.
that way.
Yeah.
I've never thought that way.
Yeah.
So I need to be afraid of it. And then my family saw me get so depressed and so that they talked me into calling and getting a new pain doctor.
Yeah.
Because I wasn't going to do it. I didn't want to get worse. I
Well,
was already worse.
I know you're still in pain.
Mhm.
This isn't going to be 100% resolution.
No,
Not until God gives us new bodies, right?
that's right.
But truthfully, the difference seeing you is night and day. I know you're out with your family. I
Hmm.
know you're enjoying activities of life again,
Yes.
enjoying the air, the fresh air, the sunshine.
Oh my God.
Yeah.
To be an outside person and not be able to be outside is,
Yeah.
it's devastating. Yeah, I bought my house because my backyard, my back deck faces a pasture with horses. That's why I bought my house. I lived on the lake. I'm an outside person. And to be stuck inside, you go darker and darker. Those negative thoughts get louder and louder.
And for the record, you're on no opioids right now.
Oh, no. I'm not on any pain medicine.
Praise God.
No, I'm not. I still, meditation, distractions. You know, music it is a big one for me, but sometimes I can't listen to music because sounds can be triggering too.
Right.
You know, odors can trigger your pain with this. This is a crazy disorder because there are weird things that, you know, trigger pain.
Yeah.
Yeah, it's just strange. Material, clothes, a chair, the way it feels, and automatically you're back up again.
Well, thank you so much for sharing with us a little bit about your condition, complex regional pain syndrome. I'm sure your voice will go out and affect many people and give them some insight, hopefully some hope. And if you're listening and you're in that dark place, please, please, please do not give up. Tomorrow is another day. There's always another treatment option. It's just about finding the right one for you. And For Nelda, it was ketamine at this point and this time. And so just wanted to spend some time talking with you. And thank you so much again for being on our program.
You saved my life, Dr. Lee.
Oh, that's him, buddy.
Yes.
Thank you so
I'm
much.
blessed. Thank you.